use disorder itself, kind of following a similar pattern of, in terms of how we define and define the criteria for use disorder. But the intoxication piece and sometimes the lasting intoxication, the extremes of behavior are somewhat unique, at least in my experience, to this particular type of drug. So beyond that, we see kind of the relatively standard definitions, criteria for the use disorder criteria. So notice here that the withdrawal, the nuance of or the phenomenon of withdrawal is in fact missing from the or not missing is the wrong word, but not included in the section on the class of hallucinogen drugs. Let's look at criteria B here for phencyclidine intoxication. Actually, if I had to do this over again, I would have written this out as a list here, but these clinically significant problematic behavior changes, which is frankly understatement, as you see in that video. But think about this list as things you commonly see in hallucinogen intoxication, which is belligerence, assaultiveness, impulsiveness, unpredictability, psychomotor agitation, and impaired judgment. Definitely some of the most dangerous and extreme behaviors I've ever seen clinically have been in the context of hallucinogen intoxication. Criteria B in the previous slide is kind of the behavioral manifestation of intoxication, and then this list is really the more physiological manifestation of intoxication. So if you've ever heard the term flashbacks in the context of someone using a hallucinogen and then experiencing symptoms of intoxication, that's actually called hallucinogen persisting perception disorder. Okay, and it's defined as re-experiencing one or more perceptual symptoms listed out here sometime after the cease of use, and that can be for an extended period of time, and it can be something. This is not from the book. This is purely from my anecdotal experience. But I have absolutely seen people, not all the time, but I've seen instances where people have used hallucinogens, not even in the context of a use disorder per se, but have years later instances of this persistent perception disorder. So, so kind of that's what the definition is. So one of the points that they make here is, now I've seen personally in my clinical experience, what I've seen is more episodic, but certainly, and if it's continuous, it's usually in the context of something else. Like someone is, like a young person is using hallucinogens either one time or on a use disorder type of basis, and suddenly we come to the conclusion later that they have schizophrenia, and as a for instance. And so the question is, well, did the hallucinogens cause such an illness? There's no way to know for sure, I suppose, but just know that this persistent perception disorder can be episodic, or, as using their words, nearly continuous, and it can be permanent.